The United Kingdom has detected another new strain of coronavirus, which appears to be even more infectious than the last. 2 people linked to travellers who recently returned from South Africa have tested positive to the new variant. They're now in isolation. The positive cases have triggered immediate restrictions for anyone seeking to return from South Africa. From Thursday, direct flights to England will be banned. Exemptions are available for British and Irish nationals and visa holders.
Yet another new strain of the coronavirus in the UK, this one with origins in South Africa, and the Health Secretary announced immediate action to stop it spreading.
We've detected 2 cases of another new variant of coronavirus here in the UK. Both are contacts of cases who have travelled from South Africa over the past few weeks. Anyone in the UK who has been in South Africa in the past fortnight, and anyone who is a close contact of someone who's been in South Africa in the last fortnight must quarantine immediately.
The variant called 501v2 has caused a surge of infections in parts of South Africa. It has a higher transmission rate and may be more prevalent in the young. Significantly, the mutations could enable the virus to elude antibodies from a previous infection.
That has the potential to mean that people can get reinfected, potentially. And that's something that we're actively studying at the moment to see how many of the recent infections and the cases that are coming through are possibly reinfections.
And what about the vaccine?
We're trying to very rapidly understand what the implications are for the vaccines.
Scientists are also double-checking that the vaccines work against the UK variant, though they do believe it's unlikely that there will be problems. There is still no evidence that the strain causes more serious disease, but it has spread nationwide with a higher proportion found in children, and that could make control more difficult if schools are allowed to reopen in January.
This is mostly during the lockdown period in November. You see a statistically significant increased proportion of cases in under 15-year-olds for the variant compared with the non-variants. Children are now more like adults in their infectiousness than they were with the previous strains. That will pose greater risks in transmission involving children mixing with each other.
The chance emergence of 2 new variants that evolved thousands of miles apart underlines the importance of rolling out the vaccine worldwide. The pandemic isn't over until it's over everywhere, or the virus could come back to haunt us.